5 subtle morning signs that could indicate cancer. Over 60. Are you over 60 and waking up with new aches, pains, or just feeling off? It's easy to dismiss these changes as just part of getting older. But what if your body is trying to tell you something important? What if it's a whisper of a bigger problem, something like cancer? In this video, we'll explore 5 subtle morning signs that could indicate a serious health issue, and what you should do if you notice them. Stay tuned until the end, because this information could save your life. And if you haven't subscribed yet, hit that subscribe button and the notification bell so you never miss our crucial health updates. Let's dive in. Number 1. Unexplained itching. We all experience the occasional itch. Dry skin, a mosquito bite, an encounter with poison ivy. These are common culprits that usually resolve on their own. But what if the itching is persistent, intense, and you can't pinpoint a cause? What if it's worse when you wake up in the morning? While it's easy to dismiss it as just dry skin or an allergy, a persistent, unexplained itch, particularly one that intensifies in the morning, could be a sign of something more serious, potentially even a hidden health issue, like cancer. Certain types of cancer, such as lymphoma and leukemia, can trigger intense itching due to the release of specific chemicals called cytokines. These cytokines are part of your body's natural defense system, playing a vital role in the inflammatory response that helps fight off infections and heal injuries. However, when these cytokines are overproduced, they can wreak havoc on your system, irritating the skin and causing widespread itching. Imagine your body's internal alarm system malfunctioning, constantly blaring a warning signal, even when there's no immediate threat. That's what an overproduction of cytokines can feel like. Now, before you jump to conclusions, it's crucial to remember that itching doesn't automatically equate to cancer. Many benign conditions can also cause persistent itching, such as eczema, psoriasis, or even an allergic reaction to a new medication or detergent. Dry skin, especially prevalent during the colder months, is another frequent offender. However, if the itching is severe, widespread across your body, doesn't respond to over-the-counter remedies like moisturizing lotions or antihistamines, and is accompanied by other symptoms like unexplained weight loss, fatigue, or night sweats, then it's absolutely crucial to consult your doctor. Don't hesitate to schedule an appointment. Your doctor can perform a thorough examination, run some blood tests, and determine the underlying cause of your persistent itching. Early diagnosis is paramount, especially when dealing with potentially serious conditions. Think of it this way. Early detection is like spotting a small crack in a bridge before it escalates into a major structural failure. Addressing the issue in its early stages can prevent significant complications down the line. In the case of cancer, early diagnosis can significantly improve treatment outcomes and increase the chances of successful recovery. So, while it's important not to panic at the first sign of an itch, it's equally important not to ignore a persistent, unexplained itch, especially if it's disrupting your sleep or impacting your quality of life. Listen to your body. Pay attention to the signals it's sending, and don't hesitate to seek professional medical advice when needed. Your health is your most valuable asset, and being proactive about it is always the best approach. Number 2. Changes in bowel habits. As we age, our digestive systems can get a bit unpredictable. It's true. Things slow down, sometimes speed up, and occasionally throw us a curveball. We might experience occasional bouts of indigestion, heartburn, or changes in bowel regularity. This is often attributed to age-related changes in gut motility, the natural contractions that move food through our digestive system. As we get older, these contractions can become less efficient, leading to slower transit times and an increased risk of constipation. Dietary changes, decreased physical activity, and certain medications can also contribute to these digestive shifts. However, while some changes are considered a normal part of aging, significant and persistent alterations in your bowel habits, things like chronic constipation, persistent diarrhea, a noticeable change in stool consistency, becoming very narrow or ribbon-like, or the presence of blood in your stool, shouldn't be ignored, especially if you're over 60. These can be early indicators of more serious underlying issues, including colon or rectal cancer. Colon cancer, one of the most common cancers in older adults, often begins as small, non-cancerous growths, called polyps, on the inner lining of the colon. These polyps, while generally harmless initially, can sometimes develop into cancerous tumors over time. As these polyps grow or cancerous tumors form, they can bleed or irritate the lining of the bowel, causing noticeable changes in your bathroom routine. You might experience more frequent urges to go, a feeling of incomplete evacuation, or abdominal cramping and discomfort. The presence of blood in the stool, which can appear bright red or dark and tarry, is a particularly concerning sign and should never be dismissed. It's important to note that not all bleeding is due to cancer. Hemorrhoids, anal fissures, and certain medications can also cause rectal bleeding. However, distinguishing between these causes requires a medical evaluation. Pay close attention to the frequency, consistency, and color of your bowel movements. Keep a mental note of your typical bathroom habits, and be alert to any deviations from the norm. If something feels different, persists for more than a couple of weeks, and especially if accompanied by other symptoms like unexplained weight loss, fatigue, or persistent abdominal pain, it's absolutely crucial to talk to your doctor. Don't hesitate to schedule an appointment and discuss your concerns. A simple screening, such as a colonoscopy, could save your life. A colonoscopy allows the doctor to visualize the entire colon and rectum, identify any polyps or abnormalities, and remove them if necessary, preventing them from potentially developing into cancer. Early detection is key when it comes to colon cancer. When caught in its early stages, colon cancer is highly treatable, with significantly improved outcomes and a higher chance of successful recovery. Think of it this way. Your bowel habits are like a window into the health of your digestive system. While occasional irregularities are to be expected, consistent and significant changes could be signaling a deeper issue. Don't be embarrassed or afraid to discuss these changes with your doctor. They are there to help you navigate these concerns and ensure you receive the appropriate care. Your health is your most valuable asset, and being proactive about it, especially as you age, is always the best approach. Number 3. Swollen lymph nodes. Lymph nodes are small, bean-shaped structures strategically positioned throughout your body, acting as vital filtering stations within your lymphatic system. This intricate network, a crucial component of your immune system, plays a pivotal role in safeguarding your health by trapping and eliminating harmful invaders like bacteria, viruses, and cancerous cells. Think of them as tiny, vigilant sentinels, constantly patrolling your body for any signs of trouble. When your body detects an infection or other threat, these lymph nodes can become swollen and tender as they diligently work to combat the invading forces. It's a natural and often temporary response, a sign that your immune system is actively engaged in protecting you. You might notice these swollen glands in your neck, under your arms, armpits, or in your groin area, the regions where lymph nodes are concentrated. This swelling typically subsides once the infection has been resolved. However, if you observe persistent swelling in your lymph nodes, particularly in the neck, armpits, or groin, especially if it lasts for more than a few weeks and isn't associated with any obvious infection. It's essential to seek medical attention. This persistent enlargement could potentially indicate a more serious underlying issue, such as lymphoma or other blood cancers. These cancers can originate within the lymphatic system itself, disrupting its normal function and causing the lymph nodes to swell. Lymphoma, for instance, is a type of cancer that affects the lymphocytes, a specific type of white blood cell that plays a critical role in your immune response. As these cancerous lymphocytes multiply uncontrollably, they can accumulate within the lymph nodes, causing them to enlarge. Now, it's crucial to remember that a swollen lymph node doesn't automatically equate to a cancer diagnosis. Many benign conditions, such as common viral or bacterial infections, can also cause lymph node swelling. Even minor cuts or scrapes can trigger localized swelling in nearby lymph nodes. However, certain characteristics of swollen lymph nodes can raise red flags and warrant further investigation. If the swollen lymph node feels hard, is painless to the touch, and doesn't diminish in size after a few weeks, it's especially important to consult your doctor. These features can sometimes be indicative of a more serious underlying condition, including lymphoma. Your doctor will conduct a thorough physical examination, carefully palpating the swollen lymph nodes to assess their size, texture, and tenderness. They'll also inquire about any accompanying symptoms, such as fatigue, unexplained weight loss, night sweats, or persistent fever. Depending on their initial assessment, they may recommend further diagnostic tests, such as blood tests, imaging studies like CT scans or ultrasounds, or a biopsy of the lymph node. A biopsy involves removing a small sample of tissue from the affected lymph node for microscopic examination. This procedure is crucial for definitively diagnosing lymphoma or other potential causes of the persistent swelling. Early detection is paramount when it comes to lymphoma and other blood cancers. When diagnosed in its early stages, lymphoma is often highly treatable, with significantly improved outcomes and a higher chance of successful recovery. So while it's important not to panic at the first sign of a swollen lymph node, it's equally important not to ignore persistent, unexplained swelling, especially if it's accompanied by other concerning symptoms. Listen to your body, pay attention to the signals it's sending, and don't hesitate to seek professional medical advice when needed. Your health is your most valuable asset, and being proactive about it is always the best approach. Number 4. New or changing moles. Our skin, the largest organ of our body, serves as a protective barrier against the external world, shielding us from harmful elements and regulating our internal temperature. As we journey through life, our skin bears witness to the passage of time, accumulating marks and blemishes that tell a story of sun exposure, environmental factors, and the natural aging process. Among these marks, moles stand out as common and often harmless skin growths, typically appearing as small, pigmented spots ranging in color from light brown to dark black. Most moles develop during childhood and adolescence, scattering across our bodies like tiny freckles, reminders of sunny days spent outdoors. While the vast majority of moles pose no health concerns, it's crucial to remain vigilant and observant of any changes in their appearance, especially as we age. New moles appearing after the age of 30, or existing moles undergoing noticeable transformations, warrant careful attention and should prompt a visit to a dermatologist. These changes could potentially signal the development of melanoma, a serious and potentially life-threatening form of skin cancer. Melanoma arises from melanocytes, the specialized cells responsible for producing melanin, the pigment that gives our skin its color. Uncontrolled growth and proliferation of these melanocytes can lead to the formation of malignant tumors, often manifesting as changes in existing moles or the appearance of new, atypical moles. Remember the ABCDEs of melanoma detection, a simple yet powerful tool for identifying potentially cancerous moles. *A for asymmetry. A benign mole is typically symmetrical, meaning one half mirrors the other. Melanoma, however, often exhibits asymmetry, with one half of the mole appearing different from the other. Imagine drawing a line through the center of the mole. If the two halves don't match, it's a potential warning sign. *B for border irregularity. Benign moles usually have smooth, well-defined borders. Melanoma, on the other hand, often displays irregular, notched, or blurred borders, resembling a jagged coastline rather than a smooth circle. *C for color changes. Benign moles typically maintain a uniform color throughout. Melanoma can exhibit variations in color, with shades of brown, black, tan, red, white, or blue appearing within the same mole. This mottled appearance, like a painter's palette, should raise a red flag. *D for diameter. Benign moles are generally smaller than 6 millimeters in diameter, roughly the size of a pencil eraser. Melanoma often exceeds this size, growing larger and more prominent over time. While a mole larger than 6 millimeters doesn't automatically indicate melanoma, it warrants close monitoring and professional evaluation. *E for evolving. Benign moles remain relatively stable in appearance over time. Melanoma, however, tends to evolve, changing in size, shape, color, or elevation. It might also develop new features, such as itching, bleeding, or crusting. Any noticeable change in a mole, even a subtle one, warrants prompt medical attention. If you observe any of these ABCDE characteristics in a mole, or if a mole begins to itch, bleed, or ooze, don't delay seeking professional advice. Schedule an appointment with a dermatologist as soon as possible. Early detection is paramount when it comes to melanoma. When caught in its early stages, melanoma is highly treatable, with significantly improved outcomes and a higher chance of successful recovery. Regular self-skin exams, performed monthly, are also crucial for identifying any suspicious changes early on. Familiarize yourself with the appearance of your moles and be vigilant for any new growths or alterations in existing ones. Your proactive approach to skin health could be life-saving. 5. Persistent mouth sores. Occasional mouth sores are a common nuisance. We've all experienced the minor discomfort of a canker sore or a bitten cheek. Those small irritations that typically heal within a week or two, without much fuss. Canker sores, small, shallow ulcers that appear inside the mouth, are often triggered by stress, minor injuries, or certain foods. A bitten cheek, a common mishap during chewing, usually heals quickly on its own. These minor oral irritations are generally harmless and resolve without intervention. However, a sore that lingers, refusing to heal within a couple of weeks, warrants further investigation, especially if you're over 60. This persistent sore could potentially be a sign of oral cancer, a serious condition that requires prompt medical attention. Oral cancer, a type of head and neck cancer, can develop on the lips, tongue, gums, the floor of the mouth, or the inside of the cheeks. It often begins as a small, painless sore or lesion that may appear white, red, or a mixture of both. These precancerous lesions, if left untreated, can progress to invasive squamous cell carcinoma, the most common type of oral cancer. Certain risk factors significantly increase the likelihood of developing oral cancer, including tobacco use, smoking cigarettes, cigars, or pipes, or chewing tobacco, excessive alcohol consumption, and prolonged exposure to ultraviolet UV radiation from the sun, particularly on the lips. The combination of tobacco and alcohol use creates a synergistic effect, dramatically elevating the risk of oral cancer. Human papillomavirus, HPV infection, particularly HPV-16, has also emerged as a significant risk factor for oropharyngeal cancer, a type of oral cancer that affects the back of the throat, including the base of the tongue and tonsils. Early detection is paramount when it comes to oral cancer. The earlier the diagnosis, the better the prognosis and the higher the chances of successful treatment. Regular dental checkups play a crucial role in early detection, as dentists are often the first to identify suspicious lesions during routine oral examinations. However, it's essential to be proactive about your oral health and perform regular self-exams as well. Take a moment to examine your mouth in a well-lit area, using a mirror to inspect your lips, tongue, gums, and the inside of your cheeks. Look for any unusual sores, patches, lumps, or changes in color or texture. Pay attention to any areas that feel numb, tender, or painful. If you notice anything unusual that persists for more than 2 weeks, don't hesitate to schedule an appointment with your dentist or doctor. During your appointment, the dentist or doctor will conduct a thorough oral examination, carefully inspecting the suspicious area and palpating the surrounding tissues. They may also perform a biopsy, a procedure that involves removing a small sample of tissue from the lesion for microscopic examination. A biopsy is crucial for confirming the diagnosis of oral cancer and determining the stage of the disease. If oral cancer is detected, treatment options will vary depending on the stage and location of the cancer, but may include surgery, radiation therapy, chemotherapy, targeted therapy, or a combination of these approaches. Don't dismiss a persistent mouth sore as just a minor annoyance. It could be your body's way of signaling a potentially serious problem. Be proactive about your oral health. Practice good oral hygiene, limit your alcohol consumption, avoid tobacco products, and protect your lips from excessive sun exposure. Regular dental checkups and self-exams are crucial for early detection, which can significantly improve treatment outcomes and increase the chances of a full recovery. Your health is your most valuable asset, and being vigilant about it is always the best approach. So, there you have it. 5 often overlooked warning signs that could indicate a serious health problem. Remember, these symptoms don't necessarily mean you have cancer, but they warrant further investigation. Don't hesitate to talk to your doctor about any concerns you may have. Early detection is key, and being proactive about your health is the best way to ensure a long and healthy life. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and share it with your friends and family. Also, be sure to hit that notification bell so you don't miss out on our latest tips on life after 60, all for free. Your support helps us continue creating valuable content for your well-being. Thank you for watching, and we'll see you in the next video.